We develop devices that haven't existed before, and that enables us to ask questions that were not possible without the new tools and instruments and devices that we make. I'm Shaurya Prakash. I'm a professor of mechanical and aerospace engineering at Ohio State. In our lab, which is the Microsystems and Nanosystems Laboratory, we make discoveries that relate to solving problems in healthcare and water treatment. We rely on principles that come from nanoscience and nanotechnology, and we build small-scale devices that are portable, handheld, and work at the chip scale. It comes with a balance of borrowing from the science and technology, both at the nanoscale and the microscale, which are really tiny length scales. And then we try to exploit the phenomena that arise out of that. And so we control how motion of atoms and molecules, liquids, solids, and electrical charge works at these length scales using the devices that we develop. And we harness that knowledge to build discoveries for cancer diagnostics, wound healing. The goal is to have devices that work in an environment that is portable, handheld, or in a resource-limited setting where access to technology is limited. Recently, one of the breakthroughs we made is develop an electroceutical technology, which is the electrical stimulation dressing that goes on chronic wounds. It disinfects them and it heals them. Prior to our device, the primary method of care was to either scrape the infection off or treat it with antibiotics. In many cases, we found that those methods were not particularly helpful. And this is particularly true of chronic wounds, which means wounds that don't heal over extended periods of time and become infected. So our method disinfects the wound and kills really hard to remove bacterial infections. Personally, it was rewarding because during the development phase, we tested it out on a couple of dogs and cats as part of the study, and it helped save the lives of a couple of innocent animals. It's been licensed for commercial use. So a company has licensed that product from Ohio State and will be taking it out to helping actual patients. We've been working on building a chip that analyzes fluids from various patients, looking at urine, blood, saliva, to build a composite scorecard that tells us what a person's cancer risk might be. Here's an example of one of the chips we make. These are chips that take in some biofluid, let's say urine, for example, from a person, and then it sorts the components of urine into its ingredients. And then we study those to look for biological markers that could suggest cancer may or may not be present. So our goal is to find that earliest time point where we can pick up on cancer even before the traditional methods can diagnose. This can help lots of people even perhaps one day do home screening for a variety of cancers. We have some amazing students, staff, faculty that we work with, collaborate with. And it means so much more when you make a team discovery that leads to new science, new technology, and can help folks outside of the lab we're in.